and a sister who either died or living with HIV. My sister told me, she said, boy, if you having sex, you at risk. And if you having unprotected sex, you even at a greater risk. I know, brother. We've been taught to sow our wild oats, but trust me, we gotta start loving ourselves. We gotta start taking responsibility. Get tested. Wear condoms. Know your partner's status. Even abstain. I'm just saying, isn't your health worth it? Get it together, man. Get tested.
So are we just going to ignore the fact that South Carolina is number 8 in the country in the health and rising of new HIV cases? See, results like this is what ignoring the problem looks like. I am so tired of people sitting on their hands and turning a blind eye to the devastation and the disease in South Carolina. Come on, people, we are in crisis. Come on. There are too many people still doing nothing or just being oblivious to the fact that we are devastated in our own community. Wake up, people. Columbia is fifth in the country, and the rate of HIV is rising every year. And every year I am in the trough of it, begging people to do something, anything. So what is it going to take to get you to wake up? Open your eyes and see the effect of this disease. Okay, I know that we have come a long way since we first discovered HIV. But y'all, we have reached epidemic proportions of the rate of HIV and AIDS in black gay men, 18 and 29. And for black women, we are 80% of all the HIV-infected women in South Carolina. But still, we ignore the truth. But the truth is, I'm tired. I am tired of walking around these folks with these HIV-infected children that can't say anything because they're afraid. Why are they afraid? Because we make them afraid. HIV is no longer a death sentence, people. So let's stop treating people like it is. Because truth be told, we can all get access to that medicine that Magic Johnson has and all those good results he has as well. So please, please help us, Mr. and Mrs. Politicians, by passing bills into law that include health care for everyone. And stop looking at me like that. Stop looking at me like that. I see y'all. I see the way y'all look at me. I know y'all thinking, oh Lord, here come that HIV advocate girl again. Oh gosh. But yes, I'm going to keep coming. I'm going to keep getting in your face, and I'm going to keep talking until you do something and see. People are using the emergency room in everyday health care. And some of them work every day. Come on, people, help us. Help us, Mr. and Mrs. Business Owner, by just donating something to an HIV center each year. And educate your customers on the epidemic in your own community. That's all. And please help us, Mr. and Mrs. Student, by just protecting yourselves with condoms and being responsible with your partners. That's all. That's the only thing that we ask. Because y'all, we all have a responsibility to do our part. No matter how small, if we want to take this disease out of our own community. Guys, wake up. Now I know that we're in 2017 and we don't have a cure yet, and that's frustrating. But we have to keep moving forward because people are getting infected every single day with this disease unnecessarily. So we gotta do something. We need you. We need research. We need finances. We need ways to get PrEP. We especially need more non-judgmental health care for those who need it. So come on, get involved. Do something. When is enough? Get involved.
Be responsible.
Don't be stupid.
Show love.
Wrap it up.
Say something.
Be informed.
Get tested. Can we get one more round of applause for our production team? We also have more awareness through the arts. Mr. Anthony Lewis, if you look to my left, your right, is working on a live painting entitled No More Secrets. This painting is estimated at $800, and the minimum bid tonight for our silent auction is $450. All proceeds from the silent auction will go to the HIV and AIDS Council. Can we please have a hand for Mr. Anthony? Also, as you walk throughout the venue, you can see some of his other artwork displayed in the areas throughout the venue as well. Paint the Town Red was thought by Chelsea Evans, who is a graduate of the University of South Carolina. She graduated in 2014 with a degree in public health. She is in her third and final year at USC Law School, and she was educated and elected the first Black editor-in-chief of the South Carolina Law Review. The first Black in school history. I think she deserves to talk about. Chelsea is active in various organizations, most notably the Pro Bono Board at the University of South Carolina's Law School. On tonight, we would like to honor 3 honorees who have done amazing work in our community with the Chelsea Evans Community Leadership Award. Please welcome Ms. Chelsea Evans.
Wow. Tonight I am extremely humbled and my heart is so full. A few years ago, I approached the talented 10th, Dr. Gaddis, and WOW Productions about hosting a benefit to raise awareness about HIV and AIDS. I was a senior in college at the time, and the event was actually the product of a class project I had done my first or second year. I initially wanted to do the event on campus, but I soon came to realize that this issue was way too big and I didn't want to limit it to the university community. I was struck by the statistics in South Carolina and the seeming unwillingness to have an honest and open dialogue about an issue that affects so many people and so many families in our community and in our state. Thus, Paint the Town Red was born, and we successfully hosted this event for the first time in 2014. I am so proud to have played a role in an event that brings so many people together and seeks to educate on the facts, dispel stereotypes, raise some money, and begin to break down the stigma surrounding HIV and AIDS. I'm incredibly grateful to this year's organizers. You guys did a great job, and thank you so much for your hard work. I appreciate your commitment to make this an annual event. I'm also grateful to the talented 10th, South Carolina HIV and AIDS Council, and WOW Productions for the work they do every day and for taking a chance on me back then. I'm grateful for the sponsors and donors because this work cannot be done without your support. So, yeah. And I'm grateful to the attendees here tonight and anyone else I missed because your participation and presence here speaks volumes about your commitment to this cause. So tonight I'm here to present the Chelsea Evans Community Trailblazer Award. Now, I'm truly honored that you all decided to name this award after me, but I must admit that I had several good laughs about the irony of it, and it's hard for me to say the name of the award with a straight face. Tonight's recipients have accomplished a lot more than I have yet to do in my 25 years of life. These recipients give so much of themselves to our community, and they are truly models of what we should all seek to do throughout our lives: live purposefully. With that being said, our recipients for tonight are Dr. Darren Davis and Rosalind Goodwin. So I'm going to talk a little bit about tonight's recipients. Start with Dr. Davis, who has been an educator for almost 20 years. He's Richland School District 2 Superintendent. Davis served as one of the district's assistant superintendents prior to his transition year as superintendent-elect. As an assistant superintendent, he supported overall educational excellence in schools by providing leadership, administrative direction, supervision, and technical support. During his career in education, Davis has served as a successful school leader in rural, urban, and suburban school systems, where his schools were recognized for closing the achievement gap, increasing graduation rates, and increasing advanced placement participation rates. While principal of Spring Valley, the school was recognized by the Washington Post as one of America's most challenging high schools, and by Newsweek as one of America's top high schools. Our second recipient, Mrs. Rosalind Goodwin, is Vice President for Engagement and a lobbyist for the South Carolina Hospital Association, also known as SCHA. Passionate about improving the well-being of populations through health and human services, she serves as the primary link with many private and public sector stakeholders, including policymakers, community, and advocacy at the beginning. And we just wanted to recognize her for all her work she does on the ground every single day, advocating for these issues. So please have Miss Vivian Armstead. Can we get another round of applause for all of our recipients? And at this time, I would like to bring up Dr. Jacob White from the South Carolina HIV/AIDS Council.
Good evening. Let me first start by saying that Dr. Gaddis, of course, you know Dr. Gaddis, she would be here, but she worked so hard, and so she's just taking a little bit of time for herself to celebrate her husband's birthday today. They are in New Orleans, which is the city in which she got married to her husband, but knowing Dr. Gaddis, you also need to know that tomorrow there's a conference that starts in New Orleans. And so she will be attending the conference starting sometime tomorrow. But I want to say on behalf of Dr. Gaddis and the Joseph H. Neal Wellness Center that we certainly appreciate the talented 10th, and we appreciate this evening. Because one of the things that we are faced with so very often, and we hear over and over, is that so many people actually believe that HIV is no longer an issue. We hear it all the time. It has fallen off of people's radar. And so we think that we're doing a great job. We think that we are educating, advocating. We are all about social justice, and certainly if you know Dr. Gaddis, she is all about social justice. And yet so many individuals have become blind to this epidemic that has gripped this nation, has gripped the South, has gripped South Carolina, and has gripped this community. And so we know that it takes far more than what we can ever do to ensure that this community knows. Certainly Dr. Gaddis is everywhere, and she's always advocating. In fact, the last performer from WOW, you give her some blonde hair and make her a little bit taller, that's Dr. Gaddis, and that's Dr. Gaddis' story, quite honestly. But we know that it takes all of us to ensure that the message of HIV prevention, and HIV treatment, it takes all of us to get that message across and get that message out. I'd like to take this opportunity also to say that I know tonight many of you probably know the South Carolina HIV/AIDS Council. But in July of this year, we actually were renamed the Joseph H. Neal Wellness Center. Joseph H. Neal, many of you may know Representative Neal. He was a champion for HIV in the state of South Carolina. And he really he was, as Dr. Gaddis would call him, the water bearer. He certainly always spoke up for HIV in the state and certainly assisted our organization. And so we became the Joseph H. Neal Wellness Center, not only in honor of him, but it was also a part of addressing the stigma that is attached to HIV and AIDS. Actually having the South Carolina HIV/AIDS Council, having HIV and AIDS in our name, actually became a barrier to care because people didn't want to come through our doors because HIV/AIDS was on our wall outside. And so we recognized that we needed to change, and we were going to change. And unfortunately, in February of this year, Representative Neal passed away. But it is with greatest honor that we were able to rename the organization in his honor. The second thing is that our focus, our mission has broadened. We've never lost our initial mission of addressing HIV/AIDS in South Carolina, especially the disproportionately impacted African American community. But we do a lot more than just HIV/AIDS. We do STI diagnosis and treatment in our Wright Wellness Center. We do hepatitis C screening, which is, whereas we have a lot of people living with HIV in the state of South Carolina, we also have many more living with hepatitis C in the state of South Carolina. So we're trying to address both issues. We have one of the first PrEP clinics in the state of South Carolina where individuals can come in. You've heard about PrEP among the performers today. It is the first biochemical intervention for the prevention of HIV. It is an incredible advancement in HIV prevention, and we are hopeful that it will take root in South Carolina as it has taken root in so many other places. But the last innovation, let's say, that the Joseph H. Neal Wellness Center, and I forget actually to say it sometimes as well, that we have is that we have gone into a collaborative partnership with the community care centers from Florida. It's the first time that an entity has engaged with us to actually provide treatment services for HIV within our facility as well as Hep C within our facility. And so we are exceedingly appreciative of that collaboration. I am going to ask at this time that all of the staff of the Joseph H. Neal Wellness Center, if you just come to the front. Now there are a few more in okay. Okay. All right. I'm also going to ask our partner organization, the Comprehensive Care Centers, and that Ms. Sumter. Actually, I just want Ms. Sumter to actually give a brief introduction to the Comprehensive Care Centers, which is the treatment arm now for the Wellness Center. Ms. Kalea Sumter, who is one of the employees. Well, actually, she was an employee of the Joseph H. Neal Wellness Center. And Comprehensive Care Centers got her. Many of you may know her. She doesn't like to say, she is Dr. Gaddis' daughter. Dr. Gaddis' grandson is actually on the end, Naheem, and there's another grandson here as well, Chase. But just want Ms. Sumter to just speak briefly on the comprehensive care centers.
Good evening. Thank you guys for being here. We're really excited because we are embarking on something new. We are now a one-stop shop for our patients. They can come to our office and receive treatment and care. They can get case management. They can get assistance with their medications, all in one place. So we are excited to offer that to the community, and we ask that you guys please keep us in mind. If you want to come down and take a tour of our clinic and see the process in which we are servicing the community, and also find out about other services that we provide, you can come on down and we will give you a tour and talk to you face to face. So we appreciate everyone for supporting us. Thank you. Yes, come get tested too.
As she was talking, actually there is one more statistic that I'd like to share. And it may be on one of the placards that you'll find around the room. And actually, I would invite you to read some of those placards because they do have a great deal of information. But one of the pieces of information that wasn't discussed is the fact that there are 1,300 people in Richland County alone who know that they're HIV positive and who have dropped out of treatment and care. And so it's all